This is an anxious time for kids and youth, whether or not they have obsessive compulsive disorder. There can be a lot to worry about when it comes to COVID-19. And if you're the parent of a child with OCD or a clinician who works with them, you've likely noticed their OCD symptoms changing and potentially even worsening or intensifying in recent months. Fighting OCD is never easy, but there are powerful tools that can help. In our new book, OCD in Children and Adolescents, the OCD is Not the Boss of Me manual, my co-authors and I share successful exposure and response prevention, or ERP for short, activities, as well as other cognitive behavior therapy strategies that can be used by therapists and by parents. ERP is at the core of treatment, but convincing a child or youth to actively engage in these activities can be really challenging for them. This is because, by definition, ERP involves the child pushing back on OCD by freely letting themselves be triggered by OCD without letting themselves use their normal way of dealing with it, which is through rituals or compulsions. COVID has created an environment in which face-to-face therapy is often not readily available, and in which there's an unusual societal focus on contamination. As such, it can be even more tricky to motivate children and youth to engage in ERP to fight their OCD. A particularly helpful technique, which can easily be applied to COVID-related obsessions and compulsions, involves empowerment activities that can be completed before starting the ERP or during times when progress is limited. Empowerment activities serve to build up the kid's confidence to face the OCD bully despite associated challenges. Here are 4 specific activities. Number 1, decorate an OCD piñata. This activity is a fun way to build motivation with children and youth of all ages. Have them decorate a piñata with representations of their COVID-related or other OCD triggers, for example, scary words or pictures. Then have them demolish the piñata, representing how they plan to fight back against the OCD bully. Sometimes the destruction of the piñata can be used as a poignant part at the end of treatment during a graduation celebration. Number 2, make a list for when life is better. Many kids benefit from making a list describing how both COVID and OCD have messed things up for them in their lives. For example, how it's kept them from having fun with their friends, or doing well in school, or has caused problems with their family. After this, they can be challenged to brainstorm on how their life will look different after the pandemic's over and after their OCD is under control. For example, they'll have more time to do fun things and there'll be less fighting at home. Next, draw a picture. Have the child or youth create an image of their OCD out of paper or even with something like clay. Then, as sessions and the ERPs continue, the child can pull or rip a piece of the picture or the sculpture off until there's no longer anything left. This provides a really nice visual and concrete example of how the OCD is getting smaller and reflects the growing benefits of fighting back. And last, write a letter to COVID-related OCD. In a similar manner to the things I just described, have children and youth write a detailed letter to the coronavirus or to OCD, expressing their anger at how it's messed up their life or how they plan to get rid of it. I hope this inspires you to empower and motivate children and youth to take back the control from OCD and to boss back the OCD bully. Better times are ahead.